a young boy with 5 siblings, him being that he's sick and the rest of his siblings are not sick. Imagine they beat him up with the dad and threw him out. Why? They said, wewe unakufa. The boy is 10. So we need to embrace that these warriors are just super smart. They have very good IQs, they are passionate, they are loving, and people need to stop also believing that they can't get married. They also deserve love. Yeah, they're just one of their kind, one of their own. Yes.
That's true. That's a fact.
Yes.
Karibu sana. This is Crimson Courage.
Thank you.
Where we talk about lived experiences of people dealing with different health conditions, especially lifelong health conditions such as sickle cell disease and disabilities.
Okay.
So I would just give you this moment to introduce yourself to our audience and just tell them a little bit about yourself.
Thank you. My name is Lilly Webala. I'm a pharmacist by profession. I run a community-based organization in Kisumu. It's a youth-led community-based organization. In our organization, we have 4 thematic areas. The main thematic area is health because I am a health advocate and also a specialist under the health platform. Under the health, we cover non-communicable diseases, sickle cell being what I'm really passionate about. Other areas, other thematic areas are social economic empowerment, inclusivity, and climate mitigation. So I will talk about health because that's what I do mostly. And under health, we support sickle cell warriors. In our organization, we have 5 of them, one of them being Michelle Omulo, a very senior advocate of sickle cell disease, and we work very closely with her. Most people ask me why I chose to support sickle cell. I am not a warrior, and I am not a caregiver. But currently, I would say I am a caregiver to over 800 sickle cell warriors who depend on me for their essential medication, for nutrition, for wellness, and just general well-being. My journey with sickle cell started 15 years ago with a domestic manager who worked for me now for 13 years. She has a daughter called Favor. She's called Concepta Mnyasa. She comes from Amalemba. We walked the journey with her, and one of the things I realized is she doesn't even know that her child has sickle cell. She just knows that her child is sick, has a blood disorder, and anytime she's sick, she needs to be given blood. So by then, as a medic, we just know the basics. Over time, I've gotten to learn that people don't even understand sickle cell. The medic specifically, myself, I just knew basics. Yeah, sickle cell is a blood disorder. That's it. I was among the bandwagon of people who believed sickle cell was witchcraft because I've had my uncle lost 9 children to sickle cell, and then we were thinking it's witchcraft until I got into the space and realized this is sickle cell and not witchcraft as people believe. So many a times we'd have to run all the way to Amalemba to pick up Favor for when she has crisis. She can't breathe, she's having low oxygen levels. We'd run to Jaramogi, then it was just level 4. And we'd go there, get admitted. We have to donate blood, myself and my spouse. And I would interact a lot with the sickle cell warriors. Now that's where my journey with sickle cell began. So I would support her, I'd get her the medication, I'd get her the support she needs. And over time, we've been doing that. She's a healthy, beautiful girl right now. And that is when we began with 1, they got to 5. And currently, we're at 800 sickle cell warriors who depend on my organization for support. Yes.
Wow. Tell us more about your organization, Lilly. What's the name of the organization? Where is it based? And if someone wants to get in touch, how would they do that?
Okay. ZUWI Afya CBO is our offices at the Youth Empowerment Center, right next to Rotary Vocational College. We open every day, Monday to Friday, from 8 a.m. to 5 p.m. And what we do basically is we support the sickle cell warriors with their essential drugs for free. We also provide them with a nutritional flour. Some of our team members are nutritionists. We have people who are very skilled on matters to do with health and wellness. And we came up with a flour that is not just any kind of flour. It's like a meal. This is something we realized in the villages and the community. Most of the warriors are not able to afford food. But with this is a game changer. You're able to, for as long as you have some little fire, you're able to just stir up something and drink and be healthy, because it's a combination of wimbi, it has soya, it has amaranth, it has, items that give them the strength, ensures that they're healthy. We are working with a certain nutritionist from Ojola, the sub-county hospital, so that we can include at least blood, clean bovine blood from the kettle. And that is in process, because one of the things the warriors need is to improve their hemoglobin, and that would be a game changer also. So basically, that's who we are. And we've been in existence since 2021. We started the journey. I'm not from Kisumu. I am from Bungoma. Our initial safari started in Bungoma. And my interest then was cancer, because I lost my dad. He succumbed to cancer. And I've lost quite a lot of close relatives and friends to cancer. And I really had a dream to set up a cancer unit, being what I saw my dad. My dad was a doctor, a very well-known doctor in Bungoma. And it pained me because he always helped people. He always got people healthy. Then he never got a chance to beat cancer. But that changed, because I realized there's so many people in the cancer space. They have opportunities, they have chances. So when I met my DM, and they had this challenge with sickle cell, and as I kept talking to more and more warriors, I realized I need to do something for the warriors, and that is where our journey began.
Wow.
Yes.
That's quite a journey from pain to passion,
Yes.
and now assisting and serving people.
Yes.
You spoke about starting from cancer,
Yes.
and ending up in sickle cell.
Mm-hmm.
So have you noted any kind of similarities between the two conditions so far?
Yes.
Okay.
One of the challenges I've realized and noted is there's a lot of stigma. That is the biggest challenge. Then, of course, even access to medical care is really limited. We are not able to diagnose cancer very easily. Some of my friends whom we've lost, my dad being one of them, my dad died of stage 4 cancer. He was a doctor, a whole consultant. And by the time, I kept telling people, Dad is losing weight. And the way he's looking, I feel like something is amiss. I think he has cancer. And my siblings would fight me and tell me, no, Dad is working very hard. This is just fatigue. Mm-hmm. Until I took it upon myself and took him to the hospital. And trust you me, his PSA levels, which determines how much cancer you have, was up there.
Wow.
And his HB, for a doctor who was seeing patients to his last day, his HB was at 5. A normal person's HB is 13. He kept falling. He kept getting fractures. And imagine, just because he had the zeal for work, he wasn't stopping. So I just said, no, Dad, let's go to hospital. And when we got to the hospital, they said he can't go back. He's very sick. That's how we walked to the hospital. He got admitted. 2 weeks later, he was in a coma. 2 weeks after that, he passed on. Mm. And it was really sad, because it made me realize diagnosis and access. It's really very, very few places. I think Nairobi, Eldoret, that's where you'll get a lot of people just being told, I think it's this, I think it's that. Nobody ever just goes directly, it is cancer. Same with sickle cell. Sickle cell, from the journey that I have walked with the warriors, diagnosis is terrible. My organization actually does genotype screening, and we do a lot of sensitization in the community, because we tell the community, you need to know your status. Just as much as people say HIV is compulsory, sickle cell is way more compulsory, because it's a menace, and it really needs to be addressed. So if you look at it, they both have, the biggest challenge is access. Mm-hmm. Yes.
Wow. So from all that pain that even comes with cancer, you mentioned the low HB. Mm-hmm. I'm so sorry you had to experience that mm-hmm. with your father, despite, the accessibility that he had. Mm-hmm. I feel it just shows the kind of gaps that we have within our health sector.
Yes.
So even with sickle cell, you find that we have low HB. Someone can just maybe collapse, or even it can just get to something very drastic, like stroke and such and such. And when you consider that, you would understand why people might think it's witchcraft and all of that, because that is just too much strife. Can you just tell us about the journey of, from stigma to up to now, where sickle cell is recognized as a disability, given that today is actually International Persons with Disability Day?
Now, you mentioned something about the HB, and one of the things that we do, and I got to learn about, especially having an MOU with the blood bank, was from my father. My father was known, and that won him a lot of support. While he was admitted at Eldoret Hospital, he got access to blood. I'm telling you, buses and buses of students. He used to lecture at Moi University. Students from schools, from institutions would come, and being that he had a low HB and he had cancer, he needed platelets. You know how hard getting platelets is. You need like 12 donors for just 1 pint. But what I would say is, and I really thank the community, they came through for him. He never lacked blood, but his HB never came up from 5. And he actually died. You could see that he was dry. He didn't have blood. So back to sickle cell and disability. As one of the things I realized is people don't know what sickle cell is. Sickle cell is a blood disorder. It is genetic. It is not witchcraft. It is the myths and beliefs that people have. They need to understand. And one thing I tell people is nobody has made anybody God to say that you will die tomorrow. I have cases where I'm doing counselling almost every day. Within the family, a young boy with 5 siblings, him being that he's sick and the rest of his siblings are not sick. Imagine they beat him up with the dad and threw him out. Why? They said, wewe unakufa. The boy is 10. I had a sit down with them. He had never been started on treatment. The father is a boda rider. We had a sit down. I sensitized them. I talked to them. And you know what I told them? I want you to bring your wife and the other children. Because as much as they're attacking their brother, for him to be sick, that means they are carriers. They will have their episodes, even if it's not through themselves, but their children. And this information needs to be done. Now, why sickle cell is a disability? A disability is any abnormality in the body that goes to attack your organs. Sickle cell being that your red blood cells are S-shaped, they're sickled. They go to attack various parts of your organs. And you'll note that from most of the warriors tend to have disability physically. So the fact that there's an abnormality with the red blood cell, the government felt it was important to gazette it as a disability, because for those who are not able to get access to proper medical care, you find so many children have disability, and the warriors alone struggle with the disease. So those are the reasons why they ended up gazetting it as a disability. Yes.
Okay, thank you for the whole journey and explaining to us, from that version of someone in the rural areas to even coming to understand it medically and going further to see it as a disability. And also in celebration of Persons with Disability Day, you mentioned you have incredible sickle cell warriors within your organization, such as Michelle Omulo.
Yes.
And one of the best quotes for disability is, disability does not mean inability.
Yes.
What are some of the unique characteristics that you have noticed about warriors from interacting with the group of sickle cell warriors that you support?
I'd start still with Michelle. She has an amazing heart. The warriors in my team, the warriors I support, the 800, they have beautiful hearts. Let's look beyond their pain. Even yourself, if you're in pain, what would you do? You're not your best. You are something else. But these warriors are smart. They have some crazy IQ. Let me use the warriors in our organization, the ones who are supporting their fellow warriors. Michelle is smart. She's educated. She has the zeal for life. There's Connell. Connell is an amputated orphan who was deserted by his family members. We took him up. Connell has an ECD certificate. He is a very good cobbler. And apart from that, he has so much fire for life. And they're 32. So I tell guys out there, whenever we go for our outreaches, we tell guys, you people believe that they won't live beyond 5. So why is Michelle over 30? Why is Cornell over 30? Why is Meshach over 30? People need to stop having these beliefs that they're just going to die. And I'm repeating again, nobody has made anybody God. You don't know when you're going to die. I may die before Michelle. So we need to embrace that these warriors are just super smart. They have very good IQs, they are passionate, they are loving, and people need to stop also believing that they can't get married. They also deserve love. Yeah, they're just one of their kind, one of their own. Yes.
That's true. That's a fact.
Yes.
And even from you dealing with different health conditions and sickle cell warriors, definitely that's a lived experience.
Yes.
Please just tell us some of the future plans that you have for your organization, or any of them that people can come in and support or put their input in it.
So I forgot to mention when I was introducing myself, being that I'm a pharmacy practitioner, I run my own pharmacy. It has really supported the organization. We have never gotten funding. I have done this solo with support from my friends, a very supportive spouse. And I've also done it. I worked at Avenue for the last 12 years. They've been so supportive. Anytime I need drugs, I need any form of support, they've always come through. And of course, the pharmaceutical companies, I've worked in the pharmaceutical space for the last 20 years. And they've always come through anytime I'd write proposals and requests for drugs and what have you. Our plans are, my pharmacy is at Alimran Plaza on ground floor. We do the screening for sickle cell there, the genotype screening. And it's not just like any other pharmacy. It's a unique pharmacy where you can come in. We have a lab, we have a doctor, we have a physio. It's a whole clinic setup because we believe in thorough, you give your client the best. If a patient comes in having joint pains, you're able to determine, is it malaria or is it an infection? We just don't treat blindly. And over time, when I started this journey with the sickle cell warriors, I started giving them the outpatient services. So these are benefits. When you're in our ZUWI Afya program, you're able to get access to this. Anytime you're sick, you're able to come and get at least checked. The warriors come, they get their HB checked, their the baseline tests, the full hemogram, malaria, liver and kidney function, they're able to come and have the assessment done there. So we have a dream. We sat down with the team of the warriors and our team as a whole, and we want to set up a clinic so that at least the warriors, we've realized most of them still come there for rehydration, for outpatient services. So we were like, we need to make this now official because the numbers are growing. Last week we were in Nyando. We served almost 200 community members. Actually, it was more than 200. 170 of them were sickle cell warriors, and each one went with the nutritional flour. They went with all their drugs, and they went happy. They went with dignity packs. So the warriors have come to me and told me, why don't you just make this a clinic so that we have accessibility? Yes, the government facilities. Jaramogi is now a level 6, so it's a parastatal. Warriors are getting challenges being sent all the way to Milimani to get access. Now, in this facility, you must have SHA. Remember, the warriors can't even afford a meal. 6,000 SHA is impossible. And here I am doing my very best to give them that service. But it's getting heavy also on me because even the people I'm reaching out to for support are like, this time I don't have. Even friends, some are not picking my calls because they feel I'm being cumbersome. Yet this is for charity. So we have done proposals. We want to set up a clinic. Our biggest numbers of sickle cell warriors are coming from Ubunga, and this is in Kisumu West. We had a meeting with the MOH and the Director of Medical Services, and we identified a facility, Ubunga Dispensary. It's not a big facility, but we just need a small space to be able to bring it home because most of the warriors are coming from there. This will save them fare, and it will bring the medical care close to home. So we've done a proposal. We believe, I know God has brought us this far, and I know we're going to get the funds to set it up so that we are able to make it happen. And this clinic will be run by the very same warriors in our organization. Michelle is going to be there. Meshach will be there. Cornell will be there. Yes. so that there's nothing as beautiful as coming to see a fellow warrior, giving you that encouragement and giving you good services. Because why we chose that, warriors came complaining that in the government facilities they are treated very badly. They are talked to badly. But here you get a lot of love and warmth. Yeah.
That's true. That's true. Even in private hospitals,
Yes.
to be honest, some doctors don't really understand how to treat a sickle cell patient, or don't go ahead to check, the things that come with having a lifelong condition,
Yes.
like mental health,
Yes.
nutrition. Are you considering that? So we really appreciate your efforts, and I hope next year, a time like this, we'll be coming back to speak about the clinic and how it's doing.
Oh, definitely.
Now, dealing with even sickle cell and having and supporting a community of sickle cell warriors, as well as interacting with the parents and caregivers and generally the whole community.
Yes.
Thinking of all the kind of prejudices and stigma and misunderstanding that surround sickle cell, do you think that local languages and actually local productions, including it in media, would help in breaking this generational kind of stigma?
Oh yes, I believe that would really come in handy. I've been in various radio stations, actually Luo, and I don't speak Luo, but my children speak Luo. My firstborn son is one of the directors for the organization. I'm mentoring him, being that I'm about to retire. But he's very fluent in Luo. And as I mentioned, my team comprises of majorly the Luo dialect members. And that has at least given me that, it's helped me so much to be able to bridge that gap, because I get a challenge. Most of them come speaking to me in Luo. When I do my interviews, of course I do it in English or in Kiswahili, but most of the presenters tend to, they're able to translate. But I believe if we're able to give the information in the dialects, in the region we are in, it'll really come in. It'll play a very big role in ensuring that the message is home. We are able to educate the community members on what is sickle cell, who is a sickle cell warrior, and what really needs to be done to reduce the prevalence. And to celebrate our warriors, we do this quite often. We had one on Valentine's Day. We celebrated with them in the hospital. During the International Sickle Cell Day, we had a luncheon. We shall have another celebration on the 19th of December. This day is a day for the warriors to come and just have fun. And on top of it, we want to hear what are their challenges. We'll have all key people who are in the sickle cell space, Novo Nordisk, the NCD Alliance, Novartis, all the key players will be there, the Sickle Cell Federation, the warriors themselves, the caregivers, doctors. We want them all to come in together. It's a day for lunch, gifting. We'll be giving them foodstuffs, clothing, dignity packs, and of course we'll be giving them their medication for a whole month. And on top of it, we'll also have doctors from Avenue who approached me today so that at least they can go, let them have a healthy Christmas. And above all, being that I have an MOU with the blood bank, we'll have a blood drive where donations will be ongoing there, because what our MOU entails is basically no warrior goes without blood. We've lost quite a lot of warriors because of various things. So for this specific event, we shall have it all there for them. That will be their Christmas gift. And another thing I forgot to mention is the unique procedure, the apheresis. This was started 3 months ago in September. Michelle Omulo was she was patient 001. And it went well. Apheresis is basically a red blood cell exchange where the sickle cell blood is removed and healthy red blood cell is given to the warrior. And this has given her, it's giving a lifeline to most of the warriors. It is not a cure, but once you get the access to it, you live at least a healthier life for the next 3-4 months. Then you need to keep doing the procedure. What I would like to voice very loudly to the community and those who can manage, this procedure requires SHA to be fully paid. And the warriors cannot afford that. We normally say there's this thing about adopting a warrior. Those who feel they can be able to support warriors, please reach out to us, and we can give you warriors you can adopt. Adopting them means you just pay for them their SHA, and they'll have access to their care. Yes.
Okay.
If you'd like to reach me, my phone number is 0799 504 897, 0799 504 897, or my other Airtel line is 0735 630 811. You can also reach me on my email for the organization, zuwiafya@gmail.com. ZUWI Afya, ZUWIAFYACBO@gmail.com. Thank you, and we hope to see you on the 19th of December in Kisumu. Asante.
This has been Crimson Courage. We've had an amazing guest, Lilly Webala. She's told us all about sickle cell, why it is a disability, and all her amazing projects that are in Western Kenya and Kisumu. This has been Crimson Courage. As always, we are hosted at CC Hub, our home. Thank you.